Hello, it's Dr. Rhonda Johnson. Today's Thursday, August 5th, 2021, and today I'm going to be talking about numbers. What's a number mean to you? What about 200 million? Well, yesterday, worldwide, the number of coronavirus cases surpassed 200 million people. 200 million people infected. The United States, Brazil, Indonesia, India, and Iran, those countries alone, represent about 38% of all global cases that get reported each day. How about this number? 4,987,755. Those are the number of COVID deaths that have been reported worldwide since the start of this pandemic. 72,790. What does that number mean to you? Well, according to the CDC director, that's the 7-day average of daily coronavirus cases in the United States last week. And that number, 72,790, surpassed the same 7-day week average this time last summer when we didn't have any vaccines. How about this number? 10 billion. Now, a single person infected with COVID-19 might carry 10 billion copies of this virus. 10 billion that can be released when somebody sneezes, coughs, sings, talks, and walks past you. And any one person can produce mutated viruses. We call them variants with every infection. That's enough to produce billions of new variants every day. That's not comforting, is it? Which leads me to ask some questions. I've given you some numbers. Do you believe these numbers are real? Do people that you know believe these numbers are real? Do they see this pandemic as real? And do they see it as a threat to them? You know, I've always wondered, at what point do people make changes to protect themselves? And sometimes it requires a personal experience or an illness or hospitalization or death of a loved one, friend, coworker, or somebody that they follow on social media to become something real to them. Now, I always feel that I have more questions than answers, but that's something to think about. And as the numbers keep rising, and knowing that one person can produce 10 billion virus particles, which can potentially lead to billions of mutated variants. You know, today's threat is Delta, but tomorrow could be Eta, which is now in several countries, or Kappa, which is in India, or Iota, which first popped up in New York City, or Lambda, which has raced through Peru, Argentina, Chile, and Ecuador. And it has shown up in the United States and Texas. And the CDC is keeping a careful watch on this one because Lambda has the ability to evade most of the current vaccines. You know it seems like we don't know what's going to happen in the future with these variants, but I want to offer some reminders. Regardless of the variant, we have tools in our toolbox to defend us against these variants, folks. Number one tool, of course, I'm going to mention are these vaccines. They aren't as effective against the original ancestral strain, but they are still highly effective. And it's true, they don't stop you from getting infected. I used the analogy before of the bulletproof vest. They don't stop the bullet. You can still get shot if you're wearing a bulletproof vest, but the bulletproof vest protects you from dying. So think of the vaccine as a protection device. It won't stop you from getting infected, but it'll greatly decrease your chances of needing to go to the ICU, and it'll greatly decrease your likelihood of ending up in the morgue. The other prevention measures we know so well. Think of these as your layers of protection, and you still need to use them even if you're vaccinated, folks. Wear a mask when you're in public places. Now, I saw somebody the other day driving by themselves in a car with their mask pulled up. Now, just remember, if you're by yourself in your car, you don't need to wear a mask. Or if you're with someone in your household, you don't have to mask. But you do need to mask when you're outside your household and when you're in public places, especially indoors. And don't forget, your mask has to fit snugly and cover your face and nose to work. Other tools in your toolbox are avoiding crowded places, remembering that hand hygiene is very important, spacing yourself away from other people to reduce your risk of inhaling their air, and cross ventilation. And don't forget, you can use HEPA air filters to help clean the air and open windows to cross ventilate. We all need to stay home if we're sick and get tested for COVID if we have symptoms. Now, I think we can help tame this beast, every single one of us. I'm all in, and I hope you are too. That's my message today. As always, my views are my own. Stay safe, folks. Use the tools in your toolbox. And as always, have a blessed day.